Good afternoon, you guys. Welcome back to Spillin' It.
Good afternoon. Today we welcome Jackie Tavis.
Tavis,
Good
you got it.
It's a German spelling. You guys will see it in the podcast description. But we welcome Jackie today. She is the owner of Flourish Medical and Wellness, and we're going to have a deep dive on hormones, menopause, lots of things.
All the things.
All the things.
All the things.
Yeah.
So we'll just kind of immediately just start kind of back, and you can like introduce yourself and why you got into what you got into and what you do and all the things. Because I am very interested in all things perimenopause, menopause.
Same.
Toxins, all that stuff.
Yeah.
Like, I love it.
Thank you so much for having me.
Heck
you guys
yeah.
are awesome.
Thank you.
I just appreciate everything you do and the voice you have for everyone.
Oh,
so thank you.
Yes.
Thank you for having me here.
Absolutely. We're so happy to have you.
Okay, so my background in medicine really started as a kid when my dad had a lot of medical issues. And so that kind of intrigued me. And so I've been in medicine for about 15 years, which sounds like forever. Do you ever get to a point where you're like, oh my gosh, I'm old?
Yeah. When I went to my 20-year high school reunion, I was like, this is crazy.
Yeah.
This is crazy.
Yeah. So 15 years.
15 years.
About 10 of them, I worked kind of doing traditional medicine at a big health group here in Minnesota.
Mm-hmm.
And during that time, I kind of learned more about what medicine is and what medicine isn't in the traditional world.
Yeah.
And I found a lot of gaps with our patients as far as really diving into lifestyle medicine, what I call foundational medicine. So how are they eating, sleeping, their nutrition? There are so many things that we aren't even taught in medical school. And that was a huge need. And I had never had a desire to have my own clinic or a practice, or I have no idea how to run a business, to be honest with you.
Yeah.
So that was never, ever on my radar.
Yep.
But I knew I couldn't keep doing what I was doing and that there was something more for me. And so God story, fast forward, whatever. Flourish came to be, and we really focus on that foundational medicine. So
is foundational different than like functional?
yeah, that's a really good question.
Because that's what my chiropractor does.
Court.
Thanks. I was like, that's different than what she said, because she said functional neurology
Yes.
is kind of what she specializes in.
Yes,
So-
that's a great question.
Yeah.
So here's how I describe that. Okay. We have traditional medicine and we have functional medicine. And I see foundational medicine as kind of the bridge, in between the two.
Got it.
So a lot of times, when I was practicing traditional medicine, I was giving a prescription for a problem.
Yes.
In functional medicine, a lot of times patients come to me from functional medicine clinics, and they have a lot of supplements for their symptoms.
Yep.
And so in between there, I think that gap is, what's the foundation?
Yeah.
What things are missing that should be there, whether it's hormones, whether it's a hormone imbalance or nutrients, what things are present that shouldn't be there, like parasites or heavy metals or mold toxicity, and then our nutrition and our diet and all of those things. And so that's really that foundational medicine where we kind of live and hang out. And I don't think there are a lot of people who practice there.
Yeah. I don't think I've ever heard that before.
Same.
Foundational. I've heard functional, but
Yep.
yeah. So cool. So people come to you and they're like, hey, what is the most common, I guess I don't even know what it would be, like perimenopause, or like for me personally, it's like I have random night sweats and then random other stuff too. But I'm like, do people come to you for that kind of stuff?
Oh,
or, yeah.
So a lot of times people are coming to us because they've been to everyone else.
Yeah.
Sure.
And so we're always kind of the last resort, which is fine. It's kind of a lot of pressure, right?
Yeah.
Like, oh gosh, okay. And so we're the last resort, and it's those random things that no one else has figured out. Like, I'm not sleeping. Yes, maybe night sweats. I feel more moody or irritable. I'm having headaches. I'm really tired. Just kind of all those
waking up in the middle of the night.
Yeah, all those like generalized things.
Yeah.
That a lot of people, I think, just hear, oh, you're just getting older. That's just part of life.
Yep.
And that can be men or women, right? It's not just women. The difference between, as we get older and as we age and our hormones change specifically, for women, it's pretty quick.
Yeah.
Especially at 40, we have about 1/3 of our ovarian reserve left. So we're born with our set number of eggs. That's how many we have. Part of what your egg does when you release an egg with your cycle is make progesterone. By the time we're 40, we have 1/3 left. So if you don't release an egg, you don't have progesterone, which is super important for sleep. It's the thing that makes you run hot at night. It can contribute to headaches, like the moody, the irritability, the PMS stuff.
Yeah.
And so that's a pretty quick change. Whereas for men, it's more of a slow decline, and they just find, oh, I used to come home and like have the energy to do these things, and now I come home and I'm like, oh, I'm just tired. I'm not myself.
My dad comes home from work every day and he takes a nap and then he wakes up and he goes back to bed.
You'll be able to tell.
Dad.
You'll be able to tell when and if that happens to me.
Oh yeah. That will be a great day if you just sat down for 5 minutes and took a chill.
Maybe
Not
when
Ethan.
I'm 80.
Yeah, there we go. So, what are their main things? Because we were kind of talking before about like toxins and parasites. How do you like figure those things out if you have those? And honestly, I'm kind of afraid to find out if I had a parasite or something.
Yeah.
I probably do.
So here's the hard thing is that they can have overlapping symptoms.
Oh.
Right. And so there's not like, oh yeah, you're up at night, it's parasites. It could be. Or you're up at night because you have low progesterone.
Yeah.
So they can be overlapping. And so it's really important to kind of get some baseline labs where we're looking at what are your parasite markers telling us? What are your hormone levels telling us? Even though it's just a picture in time, when we put that kind of that whole puzzle piece together, we're able to see where most likely is this coming from.
Yeah.
And then, the litmus test is if we address something and we do something, is it getting better?
Yeah.
And so I think a really important thing for people to remember is we can't just treat numbers on a page. And that's how I was trained, right? It's here's the x-ray, here's the diagnosis, or here's the lab values. But you have to really understand, how do the symptoms impact the labs and what's the whole picture? Because your normal or your optimal might be different than mine.
Right.
And so you really have to look at all of them together. So, your common kind of perimenopause stuff, you're going to have some periods maybe changing a little bit. You're not sleeping as well. You have more of those kind of moody PMS symptoms. Definitely like the brain fog, the lower sex drive.
A lot of people were, when I was talking about, getting my implants removed and stuff and like my symptoms, a lot of people were like, it could be perimenopause too, which yes, definitely all of those symptoms are perimenopause too, like headaches, brain fog, that kind of stuff. So you also do toxins?
Yeah.
Too? How is all of this like a blood test?
Yeah, so our typical panel is a blood test.
Okay.
And for that, like if you're going to go in and ask for labs, I would recommend doing kind of your high level, like what's called a CBC with diff. You guys have probably seen labs of that before.
Yeah.
Your gut panel, like you want to know what your gut's doing, your adrenals, obviously a full hormone panel, a full thyroid panel, because Hashimoto's is a extremely common thing that is oftentimes overlooked. And I mean, there's probably not a week that goes by that I don't diagnose someone with that had no idea that they had it.
Wow.
So that's really important. And then the toxin panel that I like is actually a urine test.
Oh.
So you're peeing and we're seeing what you're peeing out.
Yeah.
And so that looks at all different types of molds or mycotoxins, heavy metals, and then your environmental toxins, which are going to be like pesticides, herbicides, things like parabens, phthalates, phenols, all those kinds of things.
Holy cow. So when you get started, if somebody's like, hey, I want to come to you, do they do all of those tests at one time?
Typically, no.
Okay.
If I'm seeing a kiddo, a lot of times I need to know their toxins because so much stems from our nutrition and our toxin load, and a lot of times water, our water supply source. So if you don't know, EWG has a water, like ewg.org. You can type in your zip code and look at your water source and how clean it is to what you're getting.
That immediately.
Yeah.
So that's a really common one for kids.
Okay.
So typically if it's a kiddo, I'll encourage that. But I usually just start with blood work because there are some toxin markers in that CBC that can tell us, holy moly, you have a lot of toxins. It's probably worth us checking this out.
Okay. And if some of people's symptoms and stuff, they just look at that and then you kind of address whatever it is.
Yep.
Like, okay, if you have a lot of toxins, then what?
Yep. So it depends on what they are.
Yeah.
Okay. So
Yeah.
if there are heavy mold toxins, then we'll walk through a mold detox. Specifically, glutathione can be super helpful for that.
Okay.
And there's different ways to kind of go about that. But making sure if you're doing any sort of detox, it's so important to support your whole body.
Yeah.
So you want to be supporting mitochondria, supporting your liver, your drainage pathways, things like castor oil packs at bedtime.
I started doing that. Well, I mean, it was like this little thing that people were like, so the castor oil pack.
Yes.
Is that different than the belly button thing?
Yes.
It is. Okay.
Yes.
What's the difference and which is better?
Okay. So they're different purposes.
Okay, got it.
Okay. So belly button is great for digestion and like bowels and cleaning things out.
Okay.
They have castor oil packs. So it kind of looks like an
ace bandage. Is that the same thing?
But it's kind of like a pad. So it's
Yeah.
more absorbent.
Okay.
They have a liver pack. They have a thyroid pack, which actually could be really great for Nevaeh.
Oh.
And so you just put like a teaspoon or a tablespoon of castor oil on the pack, and then your liver is in your right upper quadrant. So you would just wrap it around and wear it to bed at night. And that can help keep that liver draining out well. I have had patients completely get rid of thyroid nodules by doing thyroid castor oil packs.
Oh,
Wow.
I have had patients get rid of cysts, ovarian cysts.
Really?
One specific patient they had told her, like, we have to remove this surgically. There's no other way we can get this. Like, it has to come out because
Yeah.
it was so large. And she was like, I just want to try it. Like, I'm like, go for it. Like, let's try it. Give it at least a month. And it went away completely
Wow.
just from castor oil.
That's crazy. What else can castor oil do? Because I drank it once
Yeah.
to
Why
have
to induce labor, right?
Yeah.
Yeah.
I can't even smell it now. I gag so bad. It's so horrible.
Yeah. So I don't
That's
usually
probably not
recommend
recommended.
that.
That was a wives' tale for sure.
Yeah, that wasn't like that was when Austin was born in
Yep.
2007. I'm like, people,
Yeah.
drink this, do this.
It was actually pretty common then.
Yeah.
But I usually recommend topical.
Okay.
It's great for lashes. It's great for skin. So it's
I
a
have
pretty
seen
cool
people
thing.
do it on their eyelashes too. Yeah.
I don't think you need help there.
Well, I use Babe Lash, so that it's not probably that
Insert
probably
commercial.
has. Yeah.
Just kidding.
I don't know if they have toxins or not though.
Yeah.
So does somebody if somebody was like, okay, I just want to know, can they just come in and be like, give me the full thing?
Oh yeah.
That's what I would do.
Yeah.
Be like, diagnose me with, or maybe not diagnose you, but like basically just.
Yeah. What's in there?
Yeah.
Like what is stuck in there? And usually people know pretty quickly what's getting better, right?
Mhm.
They're going to feel better. It is always amazing to me, like how much better people feel
Yeah.
with even just a simple, like we're cleaning out your liver.
Yeah.
Because if your liver is all clogged up, which so many things that we eat, drink, take, prescriptions are so hard on the liver. Like even for Nevaeh, like it'd be great for her to do liver castor oil packs
Yeah.
to keep those things moving through.
Liver castor oil
Write
pack.
that
I'm
down.
writing
Just
that
pack
down
her
right-
up.
Yep.
Thyroid,
Yeah.
liver, all the things.
Yes. Liver pack and thyroid.
Yeah.
Got it. She.
Yeah. Because everything gets so stuck in there, and
Yeah.
our liver, it's a really hardy organ. It can regenerate itself, but
Yeah.
it is stressed so much because of our just daily exposures.
Mhm.
Yeah.
And I was asking too, I'm like, before we started recording, about what if I came in right now with my implants, what maybe I would have, but it would also be
Toxin-wise.
interesting to do one before
Mm-hmm.
and then after,
Yeah, it would.
like to see just the difference.
For sure. So I would wonder mostly like implant wise, think molds,
Yeah.
right? That would be the thing I would mostly kind of be concerned
Really?
with and looking at.
Mold in it? Have you seen that? You have. Wow, wild.
Yeah.
That's freaky.
And usually people know. I mean, I think trust your gut.
Yeah.
Like people know when, and there are some patients that I have, hairstylists are a big one, where they're literally in toxins all day because of their
Yes.
products. And
Yeah.
so I have a handful of patients who are hairstylists and have implants and things like weight loss resistance. So toxins are actually fat soluble, meaning they're stored in the fat. And the reason for that is they're bad for your body, right? So your
Yeah.
body is really smart, and it's like, hey, we need to hide this and put it in a place where it's not going to impact our body.
Yeah.
So it gets stored in the fat, and then it's really hard to lose weight.
Wow.
Interesting.
Yeah.
That is very interesting. So if you are a hairstylist and you do have implants and you're like, okay, what do I do? Besides the obvious would you take out your implants, but like as far as you're working in a place where there's dry shampoo and hairspray and all
For
of that,
sure.
you're breathing it.
all the time. So there are some patients that I'm like, you probably, like, depending on how sick you are,
Yeah.
you might need to think about what you're doing on a daily basis.
Yeah.
But at a minimum, liver support, right? So your liver is doing a better job at draining those things, and then a binder. So I usually recommend what's called like a biotoxin binder or a chemical binder. My favorite are Viradchem binder and biotoxin binder are super potent and effective. So they're going to bind up to those toxins to help your body get rid of them better instead of letting it get stored.
Is that like, do you take it?
It's a supplement.
Oh, it's a supplement.
Yeah.
Okay. I
And
was
then
like,
it's flushed out through your
Yeah.
urine.
Yep.
Interesting.
wow.
Urine and poop. Always make sure you're pooping if you're detoxing.
Yeah.
Yeah. Yeah. One of the things that my chiropractor was going to have me do was, she was like, it's like a digestive one, but I have to test my poop. And I'm like,
Probably a GI map or
yes,
something.
Yep.
that's what it is. Thank you. I was like, I can't remember exactly what it is. But so after you would take those supplements and kind of detox that out. And then that makes you,
Yes. And then
feel
if
better
you're
and-
in that environment all the time,
yeah.
like that's where a daily binder, just knowing that you can't avoid exposure, just how do you better support? You know, obviously, ideally, it's we get rid of that exposure
Yeah.
Mhm.
and then you don't need those things.
Yeah.
But for some people, they can't. And so then it's just supporting your system to make sure it can continue to detox every day.
Okay.
Like especially brain fog and hormones.
Yeah.
That is a huge one. That's something even me personally. So I kind of have I think every person who's in the more functional world as a medical provider
Yeah.
has a story, whether it's with a family or themselves. And so, you know, I have my own kind of personal story of why I
Yeah.
got there. It's funny. Most of us too are like, we like to hear other people's stories.
Yeah.
So
Yeah.
we don't always share ours, but
Yeah.
it's totally fine. So, when I worked at my previous clinic for a long, long time, literally every provider there told me like, we need to check your thyroid because I was always tired. I would literally drop my kids off at school, take a nap in the parking lot before I went into work because I was exhausted.
Oh, wow.
And like, if I don't take a nap, I'm not going to be able to function.
Yeah.
Right.
And then we had kind of a big open room where all of our we shared a space for our desks, and I always had a heater. Like no matter what, winter, summer, I was
Sounds like
freezing
me.
all the time. Have you had your thyroid antibodies checked?
I haven't. Write that down.
Okay.
Thyroid, Pac for Nevea, check quartz. Check quartz.
She's probably got a checker in her car right now. Bring it in. Let's do it.
Checker. Like a blood checker. Like,
Yeah.
Oh my gosh. Okay, so couldn't poop. Like I think I'd poop like every 4 days.
oh my God. Also
Awful.
same.
So yes, so terrible. And they all checked my thyroid, and nothing wrong with what they did. It's just how we were trained, what we were trained to check.
Yeah.
But there are gaps there. And so I never had a full thyroid panel. So no one ever checked what's called my free T3 or my thyroid antibodies.
Oh.
So whatever, they were always like, your thyroid's normal. It's fine. I still felt terrible. I kept feeling worse. And then fast forward, once I kind of moved on from that world and was learning like all these things that I was never taught in school,
Yeah.
I checked myself, right? Like, where am I at? And so I have Hashimoto's.
Okay.
My testosterone level when I was, how old was I then? Oh gosh, how old am I now? I was probably like 30,
I know, right?
35.
Yeah.
Was that of like a 60-year-old,
Your what was that?
my testosterone.
Wow. Okay.
And side note on testosterone, in case you don't know this, women make 2 to 3 times more testosterone every single day than we do estrogen.
What?
Wow.
I had no clue.
It is a super important hormone for us. So the
Yeah.
brain fog,
Yeah.
that was testosterone for me.
Got it.
So circling back, that's kind of where I was going with that. So my
Yeah.
levels were crazy low and no one ever checked it. So that was a game changer for my just everyday function.
So when you get that checked, then what did you change, or what did you supplement, or?
Yep. So several things like with Hashimoto's, like cutting out gluten for sure, 100%. Then looking at, there are different support supplements for thyroid, like selenium, zinc, iodine, iron.
Zinc, I have heard that.
Yeah. Iodine, you have to be a little bit careful with, especially with Hashimoto's.
Okay.
But there are some really great support supplements for that. And then just making sure that T3 is adequate. And then testosterone wise, it's looking at increasing like heavy weightlifting. Sometimes intermittent fasting can even help as long as you're not extreme fasting.
Okay.
So you want to be a little bit careful with that. And then there are different types of, bioidentical testosterone replacement options for men and women, obviously, but even for women. And that for me, like my husband was like, "Are you a camel? Like, why do you never want to have sex with me?"
Yeah.
I thought you were going to say something about water. I was like,
I know.
camel.
So yes.
And that changed once
Oh
you.
my gosh.
That's wild. Okay, so this was when you were 35 then, and you're very interesting. I feel like I need to now get my thyroid checked.
Yeah. So my biggest, I would say, testosterone symptoms were brain fog.
Yeah.
And I can feel when my levels are low with my testosterone because immediately, like, I will forget words.
Yeah.
I noticed, like, I still remember this one day in clinic, in my previous clinic, where I was talking with a patient and I couldn't think of the word ibuprofen. And I'm like, oh my gosh, like, this is really
like,
bad.
it's like aspirin, but
like that thing that everyone takes, like if you have a headache.
Yeah.
And so I will never forget that because I felt so stupid. So brain fog is a huge one. Joint pain, aches, like a lot of inflammation. Testosterone is your most potent anti-inflammatory. So think about all the things you take ibuprofen for.
Yeah.
Again, brain fog. Sleep is another really big one, and moods. Testosterone is actually super calming as long as it's used correctly. In those people where maybe their levels are too high, it can cause some irritability and like rage.
Yeah.
But it shouldn't. That's why like men are so chill, right? They're like, whatever.
Oh, that is so interesting. I never even thought about that. So women just need more testosterone so we can be as chill as you.
Yep.
And if men have rage issues, that means they're low on testosterone?
It depends. If they're on testosterone, they might be getting a little too much.
Got it. Yeah.
And men have estrogen.
Yep.
So that's really important to keep them more. If men didn't have estrogen, they'd be really not pleasant humans.
Yeah.
Okay. Yeah. So what is the difference then? Because I know a lot of people started telling me, like, when I started talking about perimenopause and like that kind of stuff, and everybody's like, "You're too young." I'm like, "I'm 38. I don't think so." My mom went through it like when she was like 37-ish.
Oh, wow.
But when some people, women, do they get estrogen? Like they get, or people were talking about these pellets or something. And I'm like, what's the difference between, or why somebody would need that versus?
So we do pellets, we do patches, we do topicals.
Okay.
So my personal recommendation, if you're looking at any sort of hormones, male or female, is bioidentical.
Okay.
So what that means is that it is identical to what your body makes naturally. Okay. And then there's synthetic, which is not identical. So all of our hormones, whether it's sex hormones like testosterone, estrogen, progesterone, or insulin is a hormone. Okay. So all of our hormones work as kind of a lock and a key.
Yeah.
So your hormone is the key and it has to attach to its lock or to its receptor for it to work. So if that key doesn't attach, it doesn't work.
Yeah.
You want to make sure that key is identical. So imagine that synthetic hormone, like a duplicate key that was made, like it kind of works, but you gotta like jiggle it a little bit.
Yeah,
it's not
like
exactly.
the key to this office. He's like, you gotta just finagle it just a little bit.
So that's your synthetic hormone.
Got it.
And then your bioidentical is the key. Like it fits perfectly.
Yeah.
And so not only does it fit better, but your body recognizes it better. And so there are less side effects because it's just your body's natural hormone.
Yeah.
And so it doesn't kind of trigger and cascade all these other things, which can be negative when we're talking about hormones.
Right.
So bioidentical is the most important. And then the difference between whether it's like a pellet or a patch or a gel, it just depends on the person.
Got it.
Think of pellets as more long acting. So they're going to last
like a month or something?
4 months.
4 months. Wow. Okay.
Yep. And then for guys, it's about 6.
Oh, wow.
It's just like a slow release thing, right?
So it's this literally like a little pellet.
Yeah.
Like a grain of rice.
Wow.
that
And they just put it under your skin?
insert under the skin.
Yeah.
That's what I have. That's what I use.
Okay.
And then it slowly dissolves over time.
Can you feel it?
It's in your kind of like flankish, like
Oh,
hip area.
got it.
I don't really feel it. Like they're teeny.
Yeah.
Yeah.
And then it just slowly dissolves over that kind of 4-ish months.
Yeah.
And you'll feel a little bit like once those levels start dropping. The other day I was training one of our new providers and I was having some brain fog. I was like, I bet my level's like a 50 or 60.
Wow.
And it was like 57.
Wow.
Nailed it.
To be so in tune with your
Yeah.
body,
Well,
to
it's
know
been a
that
while.
it's something you learn and you get used to. Because even going to my chiropractor and like my atlas and my axis on my in my neck was off, and nobody had ever adjusted me like that before. And I now am like, oh, I remember stretching and I felt it pop, and I don't think I would have ever recognized that before until you start doing it the right way, and you're like, oh, I am off.
For sure.
It's very interesting.
Yeah.
So that's really cool.
So
I
pellets
would love to be that in tune with my body, to be like, I'm at a 57. I would love
I think
that.
it was a lucky guess.
Yeah. You were really close.
It was
You were
really
like
close.
right on.
So that's more like think long acting,
Yeah.
which is great for things like that. If you are perimenopausal, you don't want a long acting form of estrogen because your levels fluctuate. So remember, perimenopause, like you will have some months where the ovaries spit estrogen out and then some months where they don't. So testosterone starts to drop mid to upper 20s for women is when that decline starts to happen.
Wow.
Then progesterone, about 40-ish, sometimes a little bit earlier, depending on your ovarian reserve, like we talked about.
Right.
Yep.
And then estrogen's kind of the grand finale. It's like, okay, the ovaries are done. They're no longer making anything.
Yeah.
And so we don't want to use, sometimes women can go for months with zero estrogen. And that's where you're going to see like the hot flashes, the night sweats, the vaginal dryness, super moody.
Yeah.
Maybe even like frozen shoulder, like weird heart palpitations, like increased anxiety. There's over like 250 symptoms of menopause.
Wow.
That people don't even realize.
Right.
So if you have several months where your ovaries don't make estrogen, you can feel terrible.
Yeah.
But we would want to use a patch because we want to be able to take it off if your ovaries then spit out some estrogen.
So then are these people coming in once a month to get checked, or are you in a decent amount of time so they're checking?
Yeah. So typically we'll do kind of a pre where are you at, a post where your level's at, and then we do a lot of education on how to listen to your body.
Yeah. Yeah.
So it's super key because my patients will know, oh, I'm having more estrogen. Like I need to take my patch off.
Yeah.
And then, oh, my estrogen levels are low. I can feel my symptoms. They'll put it back on. So it's real. And then we can always check whenever we need to. But
so the patch is more something that helps with people who are like pre-menopause, like not in menopause, but you're getting those symptoms.
Yep. You can use it post-menopausal as well. But I wouldn't use an estrogen pellet until they stop making estrogen on their own. And then we can kind of keep it that more stable, long-acting form of estrogen.
And a lot of people, they do the pellets, or from what I've been told on Instagram, that after they had like a hysterectomy. Is that pretty common too?
Yes. So if they take out your ovaries,
right,
you'll have no estrogen, you'll have no hormones,
right,
which then sends you into like an automatic menopause,
right,
which is super important. So a lot of times what people don't understand is that pretty much every organ in our body has testosterone and estrogen receptors on it. Our heart, our brain, our bones. And what that means is that those organs need those hormones to function well.
Yeah.
Okay. So if you're 37 and you have a hysterectomy
with the ovaries, and,
everything's taken out. Your heart will have consequences from that.
Wow.
So I see this every week. Like when I see my women, all of a sudden their estrogen drops and they have zero estrogen. All of a sudden their HDL, their good cholesterol is low. Their LDL, their bad cholesterol goes super high.
Wow.
Almost always.
Yeah.
So your hormones are very protective of your brain and your bones and your heart and so many things. So it's super important to keep those levels up, because now if we're 37 and we don't have our ovaries and our uterus and we have another 50 years of living,
right,
it's going to cause some pretty significant issues as far as overall health.
Yeah.
So you'd recommend not having a hysterectomy? like wait as long as possible, or is there a certain age that you're like, this would be
that's a good
wait
question.
until whatever?
It's probably dependent on the situation,
For sure.
I would guess. But
like, why do we need it? And then if we can leave ovaries, that's ideal, right?
Yes.
So if you have, heavy, fibroids or endometriosis or something that we need to take the uterus out, but if we can leave the ovaries, that's your best case scenario, because then your body is still going to make those hormones. Now, there is an increased risk of earlier menopause even when you leave your ovaries, but you take out your uterus, just because of blood flow.
Sure.
So obviously surgically, when they're going in there, it can disrupt blood flow to the ovaries, which then can cause some more of an earlier onset menopause.
Okay.
got it. Yeah, that was one of the things that like the doctor talked to me about because for a while, my periods were like a week long, super heavy. Then I was anemic. And then they were like, we should do an ablation. Because that basically your periods will be a lot shorter. They said your cramps won't be that bad. My cramps are still just as bad.
Yeah.
But my periods are a lot shorter. But they were like, well, the next step after that, if this doesn't work, is taking out like your uterus. I'm like, I feel nervous about that because unless it's like, yes, I can handle my period. It's the cramps, whatever, are horrible.
Yeah.
But I just get nervous about taking out something I can't put back
for sure
in,
So it will change it in some way. You always have to weigh the pros and the cons. This is the one thing, like I think the interesting thing about medicine is that there's no one answer.
Right.
I think a lot of people think medicine's black and white. It is not. Like
people think everything's black and white. And like there's a lot of gray area in the whole entire world.
100%.
Like, yeah.
So you have to weigh that. Like, and that's what I tell patients. If you are seeing somebody who's like, oh, you can only do it this way. Yeah. Probably find somebody else. Yeah. Because that's never the truth. Right. And so you have to really weigh the risks and the the pros and the cons of what's worth it and what's not. But to me, like if my recommendation for you is, why are you having those heavy periods and cramps? Yeah. That is not normal. The number, like I see a ton of teenage girls for that exact type of thing, because it is like, you're like, if you go to the doctor, they're like, oh, that's how it is.
Yeah. And then they do an ultrasound and you're like, it looks perfect. And I'm like, okay, thanks.
Well,
and then I leave perfect. Like, there's no answers. I'm like, okay, well.
So your most common offenders with this are going to be parasites.
Everybody loves that word.
Yeah. It's just like gives me the heebie-jeebies thinking about it, but okay.
And then parasites and more of your environmental toxins. So like receipt paper has a lot of what's called xenoestrogens or fake estrogens that
receipt paper? Yeah. Like from a Target?
Yeah. What? Don't take your receipts.
Any place that gives receipts.
Don't take your receipts.
What? Everybody don't take your receipt. Say email only.
Have them put it on the counter, take a picture if you need it for tax reasons, and tell them to throw it away.
Didn't think that's what you were going to go with. I was like, wait, what? Okay. Receipt paper has what?
It's called xenoestrogens, or kind of these fake estrogens that disrupt your hormone system. So going back to that toxin test, that's what we see in there. And it'll tell us, like, that's why I love a toxin panel, because it not only shows us like what you're peeing out and what's high, but it shows us where is it coming from. So is this coming from receipt paper? Is this coming from your toothpaste? Like it'll kind of spell that out, like where are these things coming from? Most of the time they're coming from things.
Say my candles. That I started burning that, and then I was like, she's probably not going to like that candle over there.
Which one did you light?
Well, I didn't light it. I was burning it, but then I was like, oh, it's this. But the candles, I know they're horrible, aren't they?
They're really bad.
Oh, frick. I mean, I know they're bad because Ethan changes the filter on the frickin'
My HVAC guy has been telling me that for years.
He's like, do you guys burn candles? Ethan's like, my wife does. And he's like, it's black. Like, tell me everything.
So I just want you to just think about that for a minute. If your HVAC guy is telling you,
dude, you should see like the ceiling. First of all, this is multiple things, but the ceiling where my candle is, you can see
Oh my God.
the black up there. And it feels so vibey to me. It feels like warm and cozy, you know? But you know, my best friend Rachel, she has one of those blinds that you pull down and they're kind of like
blinds.
Cloth.
Yeah.
It used to be white. It's like a dark gray now. And she was like, yeah, remember when that was white? And I'm like,
oh my gosh.
Like
I thought you got a different one. She's like, no, it's from my candles. I'm like
a furnace filter.
Oh my gosh.
So question then, is it mainly because of the burning, like using a candle warmer like that just heats it up, but it's not actually on fire?
It doesn't matter. It's what's in the candle.
Got it.
Is there any candle? Because I bought these soy candles thinking that I think they were soy.
Yeah.
And they are marketed as better from what I've heard, but those are the only ones I burn.
Yeah.
And he just changed the filter. He has got a picture. We should post it on the thing, but it's like the new one and the one that he just changed. It was literally black.
Yeah. So, and no judgment because
of course,
loved candles.
Yeah.
Like same thing. And
I know.
And that was
I know.
That was probably a month, maybe less than a month.
What?
I know. I know. I'm like, that's how my lungs look.
She's like, how are you guys alive?
Oh my gosh.
Frick, we have to stop burning the candles, Edith.
Just go to like essential oils.
Yeah, I have diffusers.
Are those okay?
Yes.
Okay.
If they're getting good
it's
oil.
like water. Yeah, okay. So tell me about the candles. Because I know that's a big one. People are like, they're black and white with that one. Never candles ever, or yes, I love candles. You can never tell me nothing,
So it really comes down to what's in the candle, right? The different chemicals that are in there. And then you're literally burning that and inhaling that in your environment. And so you'll see those on your toxin panel. It'll be in kind of that environmental toxin list of what you're inhaling, what you're breathing in.
I'm going to have to come and get my toxins figured out for real.
Where you guys are located in Savage?
Yes,
correct?
We're in Savage.
Okay.
I have a question about that too. So does insurance cover?
Good question. We are all cash pay.
Okay.
You can submit things to your insurance, and some people will have them depending on what their out of network coverage is.
Sure.
You can definitely use like HSA and FSA if you have those. But we, for several reasons. I worked with insurance for a really long time.
Yeah.
And unfortunately, what a lot of people don't realize is insurance really dictates how we care for patients and what we're able to prescribe or tests we're able to order. I'm sure you guys have dealt with that. Like, you got to wait for insurance approval.
Yes.
And so they really, really have a big say in what you're doing and how you're doing it. And certain people have to meet certain requirements to have this test done. Right? Well, I'm not okay with that. Like, this patient needs this test. I want to be able to run it.
Yeah.
So we are cash pay, private pay. That being said, we are probably way too cheap for what we do. We've had lots of places tell us that. And my heart is really for people. Like, I don't think this should be a certain group of people who can afford this,
right?
Because these things are so important, and it impacts their health in such a big way.
Right.
So there are places out there that you can get this testing, and it doesn't have to be completely unaffordable.
So what would you, if whoever's listening or watching, what would you recommend you ask for if you wanted some of these tests done as well? And like, can you just go to a normal clinic and ask for these, or do you have to go to Google a place?
So I would look at, you wouldn't be able to get a toxin test. Like, I couldn't run a toxin test at Alino when I was there.
Okay.
But so that you'd have to look more like a functional medicine clinic, most likely.
Okay.
Maybe a chiropractor clinic might do them.
Yeah.
The lab that we use is called Vibrant.
Okay.
So you can even call and ask, like, does this clinic do Vibrant toxin panels?
Vibrant.
Or it might be on their website. So that's my favorite toxin panel. That's that urine panel that I was talking about.
Yes. Okay.
Everything else is lab. So here's the crazy thing about insurance. So the lab panel that we do initially with our patients, I think it's like $325 is the cost of that.
Okay.
And if I were to run that same panel on you through your insurance, the bill would be $2,000 to $3,000. Like I've seen this on patient. They've brought me their bill.
I just saw this
The
on
allowed amount
Instagram
through
the
the
other day
insurance.
that they were saying they called an ambulance and they thought he was uninsured. And so it was like $600, but then it went through the insurance and it was like $5,000. And he's like, can I just pay cash? And he's like, no, you can't do that because you are insured. And he's like,
Yeah.
I don't get it.
It's
It is
we could do
wild.
We're like-
years full of podcasts about
It's wild.
stuff like this.
That it
And
makes
how,
you
like,
so angry because you're like, are you I feel like you want me to be sick, which
Right.
clearly is, I mean, that's why I feel like a lot of the stuff is learned
After.
after.
Mhm.
Because even my chiropractor was like, they didn't teach us a lot of this stuff, like even in chiropractic care, which, you know, they're more natural
for sure.
at the end of the day. But she's like, there's so much that you learn. And then once you learn it, you can't like unlearn it.
100%.
Or once you see it, you can't unsee it. You're like, okay.
Yep.
Yeah.
That's exactly where I was at. I was like, okay,
Yeah.
I can't keep doing, I had no idea what I was going to do. I was
Right.
just like, I know I can't keep doing this because I just like literally, so funny.
I feel ick about it. Like I
Mhm.
have to do something. Yeah.
I went back there. It was probably a good like 6 months after I had left to get a little skin thing removed.
Yeah.
I could have just had my husband do it probably, but
Ethan would have done it like, just scalp you right off.
but I like literally start turning into the parking lot and like I don't really have anxiety, but like my heart was racing, my stomach hurt. I was like, oh my gosh. Like I think there's a lot more PTSD situation
Yeah.
happening
Yeah.
here than I even realized. Like
Yeah.
it's crazy. And when you're like, you just don't know what you don't know.
Uh-huh.
And then when you know,
then you know.
yeah.
Yeah. I feel like there's a lot of things that I've learned that I'm like, once you see it, you just can't unsee it or
Yeah.
undo
Yeah.
it, you know?
Well, and it's wild to me that insurance doesn't cover these things that
I
would
know.
actually
Help.
drive healthcare costs down and insurance premiums by starting to cover some of these
For
functional
sure.
and foundational care.
Yeah. So
Mhm.
As
why,
opposed to-
right? Like, why don't they?
Right. That's the whole reason.
Because you're
our-
actually helping.
And
Our
then it
healthcare
takes
costs
them
go
out
up.
of their system,
Mhm.
Yeah.
right? Because if we actually make you healthy,
Mm-hmm.
then we don't need to provide you care anymore.
Right.
Right.
That's not a good
I
thing.
know. That makes me sick to my stomach. So I would love to ask, what are some things that people who are listening, who's adult or they have kids, what's like the first thing if they're starting to go down this path? Because I'm very much going down this path as well because even going off my ADHD meds and then going to the chiropractor, which it sounds crazy that a chiropractor is helping you with your ADHD and memory and that
Yeah.
kind of stuff. But like, what would be their first step?
For finding care or things that they can do
Yeah,
at
like-
home.
If they're worried about I don't know, I guess it depends on what it would be, I guess. If you have perimenopause or you're like looking at your kids and you're like, okay, I want them to be, maybe I feel like they have toxins.
Right.
Mhm.
Something's off.
Yeah.
So I would pay attention to symptoms, and then a food journal is huge. So
okay.
Hmm.
Yeah.
I almost always make patients bring in food journals because,
Mm.
and it's super simple. I just bring them in and I highlight processed foods,
Mm.
right? So and it's amazing how much we eat from a box or a can or a bag, and we don't even realize it because it's just what we have available.
Yeah.
Right.
And literally just starting there for kids are so resilient. So if it's a
Mhm.
kiddo that you're worried about, literally just take a real inventory of their diet for a whole week and try to get to like 80% whole foods in a week versus 20% processed foods
Mm.
and cut out dyes,
Mm-hmm.
right?
Okay.
And you're going to see significant changes in their overall health pretty quickly. So that's a huge one.
Okay.
So that's a really good kind of starting point. If you have the hard thing too is that before you even make an appointment, I would not hesitate to ask, like, what is that provider's experience
Mhm.
with those things? Because like literally I had 0 menopause training
Yeah.
in school.
Yeah.
0. I did a talk on this and I think it was around like 20% of gynecology Residencies have menopause training.
What?
80% don't even train on menopause.
Oh my gosh.
Isn't that insane?
Well,
It's like some
yeah,
extra courses you
it
can
is.
take on the side if you want.
Yeah, because even when I went to the doctor, I just went to a normal gynecologist because I was like, I think last year was the year that I started being like, I'm sick of like how I'm feeling and my brain fog and my ADHD. Like, I want to try to figure it out. So like I went on meds and then I'm like, okay, these meds don't work. But then I started, with the hot flashes and the not sleeping through the night. And the person that I saw, like I left and I was like, I don't feel like she heard me at all or even like I got anything out of it besides, okay, we'll do an ultrasound. If you don't have a period for a year, that means you're in menopause. You look great. And I'm like, it just felt like, we were there and then we were out.
Yeah.
And that was it. And I'm like,
Checked some quick boxes.
yeah. And so I'm like, I'm the kind of person that I'm like, give me some constructive, like, this is what you should do. This is what you should watch for. And that definitely wasn't the case. And I'm like, dude, because even when we went, I was like, do you do like a hormone test to know if I'm in this or do you? And she just kind of was like, no, we'll just check your iron. And my iron's good now, but that's it.
Yeah.
So.
And unfortunately, that's so common.
Yeah.
And that is because again, like that's what she was trained to do. Like she just doesn't know. So that is a huge piece is just if you're going to make an appointment, obviously like read reviews, try to find someone who has worked with this stuff. But don't be afraid to ask like, will this provider check labs?
Yeah.
Okay. Maybe you know this, maybe you don't, but this is super important for everyone to understand. When we get labs back and there's that range on the paper and it says, some of them say reference interval, reference range, whatever.
Abnormal, normal.
Yeah. So and I used to do this. I'm totally guilty. I'm not like shaming anybody. Most of the time you'll get a note back that says like, oh, it's normal or it's not. Okay. So that range is kind of considered normal. That range is based on 95% of people who were checked.
Oh.
Not healthy people. Just
what?
95. It's just a population average.
Oh. Wow.
It's not normal to medical guidelines. It's normal as of the census, essentially.
Exactly. Think of like a 95% confidence interval. This is where, of all the labs we've tested, this is where 95% of people fall, healthy or not.
That's weird.
So do healthcare providers in the traditional setting go off of those as well? And they don't go off of like what textbook normal should be. So
they don't go what we call optimal.
Optimal. Okay.
So that's the biggest thing because I used to be that provider, like 100%. That's what I knew. That's how I was trained, where they'd come in and they have all the thyroid symptoms like I did.
Yeah.
And I check and they're normal. But think about that. Like I'm checking you and all the other people that I think have low thyroid.
Yeah.
And that's who I'm comparing you to. So unless you're like really bad and in that 5%, then we're going to tell you something's wrong. But that doesn't mean it's actually healthy.
Right. Wow.
Well, yeah. And that's when we brought some of the lab work or lab results to your chiropractor gal, who's like functional neurology and stuff. She had a couple of them where I like, everything looks, and she like pointed out like 2 or 3 that she was like, keep your eye on those.
Yep.
Like it says that they're normal, but it's a little on the higher end that I would like to see.
So Nevaeh getting actually diagnosed with Hashimoto's, it could have been, because obviously it was bad enough that they thought that, but she could have had that diagnosis earlier if it was somewhere else possibly.
Yeah. So let's think about that for a minute. So when this is how I explain Hashimoto's to people. So everyone understands COVID. Right? Yeah. And COVID antibodies. You want antibodies because that means that your immune system has tagged that as bad and it's going to attack it. Okay. So with Hashimoto's, when we're checking thyroid antibodies, right? It's if you have any antibodies, your immune system is attacking your thyroid. So there's a normal amount of antibodies present. And I don't ever diagnose someone with Hashimoto's unless they have like high levels of that. But if you think about this, like you shouldn't be making any.
Right. Yeah.
Right?
Yeah.
Because if you're making any, that's a sign that your immune system is making antibodies against your thyroid.
Right.
So they should be less than 0.
Right. Wow. Okay. So can I ask why you said that with Hashimoto's, like, did you say that like gluten-free?
Yeah.
So Nevaeh was diagnosed with type 1 and then celiac like a week later. And then the Hashimoto's came like a few years later.
Yep.
Yeah.
But I'm very curious on that.
Yeah. So the gluten protein molecule structure is very similar to your thyroid molecule protein structure.
Oh.
Okay. Like they look similar.
Yeah.
And so when you eat gluten, if your immune system is overfiring and it's triggering and it's fighting this thyroid and the gluten looks like that, it can increase that attack response. So literally just by I have had patients completely reverse their thyroid, their Hashimoto's antibodies just by cutting out gluten.
Wow.
And go down to 0.
I don't think that's I'd never heard that before.
No.
Like, I don't know if that's a very common thing to know that because I do know a few people who have Hashimoto's, but they're not gluten-free.
Mm-hmm. It's not. And it's that thing where, again, this is how we were trained. So
right.
It just is what it is, something I've learned. But that should be probably the number one thing you do, and then recheck and see where your levels are at. But it goes along with, if you ask a doctor, an endocrinologist, why do I have Hashimoto's? What caused it? Their answer is going to probably be, we don't know. It just happens, and you have to live with that for the rest of your life.
Yeah.
I don't like any of those answers personally, and I have seen that is not true.
Yeah.
So
wow.
When I deal with any autoimmune issues, whether it's Hashimoto's or celiac, like whatever it is, our approach is kind of 3 big pieces. Number 1, your gut. 80% of your immune system is your gut.
Mm-hmm.
So we have to make sure you have a good, healthy gut. Number 2, genetics. Are you a poor methylator? Do you have a deficiency in your methylation, which we can talk a little bit about? So different genetic pieces that can go into that. And then the third thing is toxicity, because if we have a lot of toxins in our body, it's constantly triggering that immune system. And then think of like a boiling pot.
Yeah.
Right. And so your body's constantly fighting this. And some people will notice that, I developed Hashimoto's after a vaccine or after pregnancy. It's just more stress on the body.
Yeah.
And now that pot boils over and the immune system is attacking things it shouldn't. So we have to address the toxins, the immune system, the gut, and then genetics.
Interesting. What about type 1? Is that?
I would approach it the same way.
Okay.
We kind of talked about my dad a little bit. It was very different back then. He actually had a kidney pancreas transplant.
Oh, wow.
Oh, really?
To completely and it worked.
Did. I was like, did it work? When did he have that?
He had it he passed away November of last year or October. But he had it for like 35 years.
Wow.
That's a whole nother situation. And I am not I don't want to sound like anti-medicine or anti-traditional medicine.
Right.
My dad would have died so much, much, much longer ago.
Yeah.
Had we not had those people, that team for him. So doing a kidney pancreas transplant is okay, now we're on anti-rejection drugs and we're suppressing the immune system. There are so many other things that come from it, but it worked for the type 1 diabetes.
Wow.
So I wouldn't necessarily recommend it.
Yeah.
I would probably recommend trying to do those other things first, which really obviously there's some gut stuff going on for her.
Yeah.
So
definitely we both should come in.
Yeah.
And me. And my mom, actually.
Man,
now that we're talking about it, make it girls' day.
Load up the car. Who wants to go?
Let's get it done.
I'll just bring my bag here.
Yeah.
Yes, there you go. There you go. We'll be we'll just do it right here. We've got to figure it out. So, okay. So a couple other takeaways that I would want for somebody. So we said kind of cut the food diaries.
Yes.
Calling and asking for, what was the Vibrant you said?
Yes.
Vibrant?
Okay. The other really important thing, water, like we talked about maybe before we started recording.
We did talk about, no, you did say
EWG.
EWG.
That's
Okay.
why I was on my phone. I was going to try to see if I could find our results quick. but-
Yeah.
Yeah.
And then, I mean, there are so many apps out there like Yucca, Skin Deep, EWG, where
Okay,
you can skin your products.
Yes, I did
That's a
just
huge
start
one.
doing that. She kind of was like, "Don't go crazy," because I know you probably will start scanning everything. And I actually am randomly like, "I'm going to scan this,
Yeah.
scan that,"
And
because
that's,
it's interesting.
it's easier for kids because usually they don't have as much. Do you wear perfume?
Yeah.
Okay, that's another one that's like
Yeah.
candles and perfume. If you're going to do anything from this conversation,
Dang it! I love both of those things.
I wear a lot of cologne.
You do too, and a lot of hairspray,
Yeah.
Mister. That's why his hair doesn't move. Even in the wind, it'll just stay right there.
so that is one of the biggest common offenders for endocrine disruption or hormone disruption.
Really? Perfume and candles. Okay,
I know, I'm
it is
sorry.
what I know. It is what it is. It's one of those things. It's like so can you tell me what is it in the perfume? Like, is it
The chemicals.
just the chemicals? Got it. Even if it says clean, do you just go like, well, don't do it. Okay.
Again, essential oil,
Yeah.
like for, scents.
Mm-hmm. What about deodorant?
Same thing. There are quite a few like healthy deodorant options now, but yes, absolutely.
Yes,
like make
that's
sure
a
you.
huge one. Okay.
Beauty Counter kind of went away for a while. They're kind of back,
Yeah.
but they had a perfume line,
Oh.
which is clean.
Mm-hmm.
But other than that, that's really the only one that I think I've like
Recommended.
really trust.
Mm-hmm.
So essential oils.
Yeah. My mom loves her essential oils.
Yeah, she does.
She's just you know what? It's her favorite. Anytime I smell patchouli, I'm like, oh, my mom's
Mhm.
somewhere around
Where
here.
is she?
Patchouli is her favorite thing.
Yep.
Okay, well, that is very good to know.
I was going to say, what do you most commonly see? You obviously see men as well.
Yeah.
Mm-hmm.
So since it's been more
Yeah.
girl related, let's get some
Yeah.
men stuff covered. So what, I mean, if guys come in for what, testosterone is the main thing
Yeah.
you see, like low testosterone levels, what is your kind of routine for?
Yeah. So same thing. We'd get the same kind of blood work, right? Because
Yep.
I would also, going back to your point, be
Mhm.
careful about like there are some just hormone clinics out there.
Yeah.
Again, I'm not trying to like speak down to about
Yep.
anything, but just be careful, ask questions because hormones aren't just hormones. They're part of the whole system.
Mhm.
And so you really have to pay attention to the whole system.
Mhm.
So we're still checking your gut and we're looking at your thyroid and we're looking at your metabolic health. So we're looking at all those things.
Yep.
The most common symptoms that we'll see in guys, low energy, brain fog is a big one. Another big one's like sleep. They're not
Okay.
sleeping as well. And then they can also see some mood changes. Like I just feel maybe more irritable, more short, more anxious. And then concentration, like their productivity at work tends to change and they really start to notice some dips there. I think we were maybe talking about this before, but for men, it's usually much more of a kind of gradual, slow decline.
Yep.
And so sometimes it's hard to pick up on. And maybe your wife might notice it more than you. Like,
Right.
Mhm.
what has happened? Like, you're just different. Of course, like sexual function, right? Like,
Yeah.
Mhm.
erections and erectile function. And, if that's changing significantly, the bigger concern there, especially with erectile function, is actually cardiac disease. Because by the time
Okay.
we're seeing erectile issues, there's a good chance you're having some cardiac stuff. It's your circulation,
Yeah, blood
right? If you
flow,
can't get
right.
blood flow there,
Yep.
Yeah.
we're having issues elsewhere.
Got it. And so for the gentleman, I would imagine you, similar to the ladies, you would, if they do go on some kind of a hormone, it needs to be more recommended a bioidentical as opposed to a synthetic.
For sure. That's my personal preference just because of the risks. Like I don't do anything that I don't recommend anything to patients that I don't do myself.
Okay.
So I am always my first guinea pig.
Yep.
And I personally would never take synthetic testosterone. I don't recommend it. I used to. When I was at Alina, that's what I would use, would be injections for men. But it is synthetic and it's in seed oils. We all know seed oils are terrible. They're extremely inflammatory. And so there's just...
Did you know that?
No.
I didn't know that.
Oh my gosh, you
I
guys.
know.
Okay.
I know. Tell us everything.
So the only...
Seed oil.
Yes. So canola oil, grapeseed oil, cottonseed oil, any oil but olive oil, avocado oil, and coconut oil those are the only 3 that aren't
It's
inflammatory.
the only 3 we
Okay.
use.
Good. Thank God. We don't use those ones, but
Yes.
okay.
And I mean, like, it's in so much of your food. It's insane.
Yeah. So look at
Yeah.
Soybean oil,
Oh, so what? That's in a lot.
a lot of stuff.
Everything.
Yeah.
So injections are in that. They're synthetic. If you're on injections, you really should be doing twice weekly injections. So again, because I used to use these when I was at my previous clinic, we would have to dose people super high because they don't last super long. And so if we want you to feel decent for a week, we need to actually get your levels higher, and then you're going to have kind of a drop off over that week. So you feel good, and then you kind of crash. So it's best to do, and then if we're getting you super high, you have higher estrogen levels, you have more of a risk of your blood thickening, erythrocytosis. So there's other things that kind of go with that.
Yeah.
And so the best way to do injections, if you're doing injections, would be twice a week.
Okay.
But it's still synthetic. So I
Right.
don't necessarily recommend those.
And the
So-
Bioidentical are not, they're not an injection.
So we have
Different.
gel,
Okay.
like a topical gel, androgel. That's
So
a
do you
very
just
common one.
put it on?
Yep.
Like
Anywhere.
a lotion?
Yeah. So you
Oh.
you don't want it to absorb onto anyone or anything else, or Poppy. That
yeah,
wouldn't be good.
Yeah. Oh, Poppy would. Poor Poppy or Russ.
Yeah.
Russ would have like a allergic reaction probably.
Probably.
Yeah. So usually like inner thigh, like somewhere that no one else is going to have exposure to. And then you just apply it every morning.
Oh, got it. Interesting. And that just goes right into your.
Yep. So it's a little bit tricky. I think it's actually harder to manage patients on creams and gels just because everyone's absorption and skin is different.
Yeah.
That's where I personally think pellets are a little bit easier to control. But both of them are options.
Is a pellet an option as well for guys for testosterone?
It's actually a little bit easier. Like I said, they like once, twice a year is when they get their, is how often they need it. So it's pretty simple. They get more, they last longer.
Got it. Okay. Interesting. All this is so much. I learned so
I
much.
know.
I'm like, where do I start first?
Yeah.
A toxin. There, I don't know if did we say this on the podcast? Like doing a before and after of my implants in and out.
Yeah, you mentioned that in the first few minutes.
So if I were you,
yes, tell me.
I would probably do a toxin panel before.
Yeah.
Do nothing for like 6 months.
Mm-hmm.
And then retest.
And then do everything.
And then see kind of what was your body able to detox on its own.
Yeah.
Just because it takes a while for it to.
Mm-hmm.
Yeah.
That's what I would do.
Yeah.
And then kind of go from there.
Get a good baseline of like, okay, here's your before.
Mm-hmm.
Here's your 6 months after it's out and, healed and all that. Yeah. I've always wondered, like, I'm like, because there are certain people who they get their implants out and the doctors that they use have a whole detox plan.
Yep.
And I don't have a plan. It's just get it out. So we'll go from there.
I'm happy to help you.
I love it.
Yeah.
If I have parasites, I don't want to know.
They are.
Do you poop them out?
Yeah.
Oh, that's what I thought. People
heard-
took pictures and somebody sent me a picture. Like these were my parasites. And I was like,
But you don't want them in there.
So I've heard.
True.
Is it
true.
is
Very
it-
true.
I feel like I've heard people say like everybody has parasites. Some of them are natural, and
Yeah.
they're good for you. Is that accurate?
So it is much more likely that you have parasites than that you don't.
Yeah.
Right.
We are the only country that does not routinely deworm ourselves. Okay. So,
Why?
and especially with you guys have 3 dogs.
Yeah. So tell me how do you get rid of them? Is this like a diet cleanse?
Okay.
Or?
So parasites eat iron and sugar.
Oh.
So I usually recommend, like, when we're working on, killing them off and getting rid of them, that we avoid those things so that we're not just feeding them.
Yeah.
They're more active over a full moon, which is super weird.
That gives me the heebie-jeebies.
So that's actually kind of a good, like, mental note to take. Like, if somebody is concerned that they may have parasites, track your symptoms or track your kids' symptoms. especially over a full moon, does it change? So are they sleeping worse at night? Do they have more tummy aches? Are they feeling more anxious? Those things typically are going to get worse because they're more active during that time. Your serotonin levels actually downregulate. So it makes it easier for us to get to you guys hear like ERs are crazy over a full moon.
Yeah.
That's because there's physiologic changes that happen in your body. And so during that time, they're also more active. So they're easier to get out. So if they're more active, usually they're causing more symptoms. So if you notice that pattern, like once a month, like my kid has these like bad tummy aches and won't sleep and is super anxious.
Grayson Allen. he loves his sugar too.
Yeah, he does.
Wait, oh my gosh. Okay. Yeah, he's a little anxious one with the upset tummy. Like where he'll be like, my tummy hurts. And I can never tell if it likes the Tums that we eat. They're like chewable and they're at night. And it's always like, I can't tell if
It's always at night?
Always at night. Yeah. He never says anything during the day. And then at night, like he gets more anxious about, I mean, he couldn't come up with the most like thinking of, there's a storm. If he even hears like there's a storm, he's like, I can't sleep. I can't. Or I just had a bad dream that this and that. And he's kind of that restless.
So pay attention, like especially it happens every month, right? I think it's around like the 12th-ish maybe. That we kind of just had one.
Okay.
Yep.
Okay.
But you could just pay attention.
So the symptoms of parasites is anxiety, upset tummies.
Sometimes it can be really, like hard to sleep at night because they're nocturnal.
Oh.
Parasites are nocturnal.
Freaking gross.
Creeping you out even more.
Yeah. Like I'm just like imagining these worms just crawling around in my body.
So the good news is that they only come out dead.
Oh, gosh.
So they're not alive when they come out. So that might be helpful. I've only had one patient. Actually, you probably don't want to know this.
I do. But just, it's like I want to know, but I don't, Just tell me.
She had super high levels.
Yeah.
And it was at nighttime and she was vomiting them.
Oh.
And then you know how vomit comes out your nose sometimes?
Oh, no.
So it like got stuck in her nose and she had to like pull it out.
How big was it? Was it big?
I think she said it was like almost
oh my!
But that was only
gosh.
once, and I've seen a lot of people, so it most likely won't happen to you.
So if you want to get rid of them, you don't eat sugar, you don't have like no beef
iron.
During that time.
Yeah, and then what? Is there an extra?
Yeah, so there are prescription antiviral or antiparasitics like ivermectin or things like that that you can use. I like to do more of a supplementation route. And the protocol that I use, it is going to cover all types of parasites. So I don't know what kind of parasites you have.
Right.
The other thing that people do, we'll do a stool test. And if you don't have parasites in your stool, you don't have them. They're not coming out willingly.
Yeah.
Right. So just because we did your stool test doesn't mean that you don't have them because they want to stay there.
Right.
So unless you're doing something to actively try and get rid of them, you can have a normal stool test and they look fine.
Oh.
But you can still have some.
Oh my.
So
wow.
So I like to make sure we're going to get rid of all of them, any of them. Cellcore, if there are people out there who are like, what is the best way to detox? That is a company that I use a lot, a supplement company. They're incredible. They're incredible humans, like good hearts, like their stuff works. And part of why I like it is because I do a lot of pre and post testing. Mm-hmm. So I know like, here's where we started. Here's where like it works.
Yeah.
So do they just like come back?
If you're having exposure, so our exposure risk is going to be things like sushi, swimming in lakes and oceans.
Oh, dang it!
Swimming in the lake. Okay, Minnesotans.
Pets.
We love
all
sushi.
Of us. Yeah, pets.
Mm-hmm.
We got 3 strikes against us right
all
now.
of them. All of them. I love my
Walking outside
sushi.
barefoot.
What? I thought you were supposed to do that.
I mean, you are, but
you get it. How
you can through your skin if you step in something where. Yeah.
Stepping in dog.
How does it get into your body? That's where I'm like, how does that happen? You step in it.
There are very microscopic parasites.
Oh, wow. Okay. And then
like you think about, like you hear about it in food, or like if you don't wash your hands well, like you don't see them on there.
Right.
You don't see them in your food.
And then do they grow in you? They do.
Yeah. So sometimes when we're doing cleanses, like they'll poop out like egg sacs.
What? Oh, I need to do a cleanse immediately. I feel like I have a parasite just talking about parasites. 100%. So the dogs too.
So that one would be a hard one.
Yeah.
I mean, I had a patient who took in some rescues.
Mm-hmm.
Oh.
And then she was actively treating them all for parasites, and her numbers were crazy high.
Wow. One of our dogs had a parasite once, didn't they? I swear.
Yeah, I can't remember which one.
Like in their poop, and I was like, this is right.
I feel like it's probably even more common in dogs and
for
humans.
sure.
Yeah, probably. They're dirty.
Dirty animals.
They really are. We love them though.
Yeah.
Yep. I have a dog.
What kind of dog?
It is what it is. A mini schnauzer.
Cute.
We call him our angry old man.
Yeah.
He's just feisty.
So is Poppy. All the time.
They would actually probably do really well together.
Probably. They could be grumpy
just
together.
A couple of grumps.
Like, just like Poppy, I'm like, all of our dogs, like dogs have like, most dogs. I mean, Presley, she's a golden. She has like no boundaries. She just loves everybody. I don't care.
Yeah.
Poppy's like, no one is allowed to touch me except my mom.
Yep.
Nobody, don't even look at me. Like Russ will come by her and she's like, "Rrr." I'm like, Poppy, you don't own. She acts like she owns everything.
Yep.
I love it. I love how she watches TV.
Oh my gosh, she is
hilarious.
She barks at the TV. I'm
Part
like,
human. Yeah.
We watched Homeward Bound. Oh my God, she watched the entire movie. You see her head like.
Yeah, she's perched on the edge of the bed,
That's
so the screen's
amazing.
like this big.
Yeah.
That's amazing.
Like you're the only dog that I've ever had that's ever watched a TV.
You should have like a Poppy.
I know she needs her own.
Yeah,
You need to revitalize the Poppy.
Poppy's World.
Poppy's World. However you did it.
I know. I should do it tomorrow.
I'm sure you have all this time.
Yeah.
So much
Be like
time.
you edit it, Ethan.
Yeah.
Just kidding. Well, thank you for coming on. I feel like we learned so much in such a short amount of time.
Yeah.
Like I have so many more questions that this would be a 2-hour thing.
Yeah, like I said, I just am super passionate about education, and and a lot of that stems from my own experience, right?
Yeah.
Like there were so many things that were missed for me,
Mm-hmm.
and so I am always happy to help answer questions.
Yeah.
Whatever I can do.
Awesome.
Yeah.
We'll put all of your information like in the description so everybody can like your business, are you okay with your Instagram too?
Yep.
Awesome.
Yep.
I am
We'll have
not an Instagram like great person.
It's okay.
But it's totally fine.
Yes.
I do show up super raw.
Yep.
I'll
Awesome.
just speak truth.
Yes.
But don't expect anything super high level.
We'll put the website on
Yeah.
there. So you have, I think you had mentioned you opened your doors in height of COVID,
Yeah.
and
That's a crazy
now
story.
you're up to like 7 providers.
Yeah. So you want to hear this story real quick?
Yeah.
Okay. So left Alina, really didn't know what I was doing. I went to work for a chiropractor who wanted to expand his kind of integrative practice.
Yeah.
Was not a good fit. Like there were different priorities, like very money focused. And that is not, again, I didn't feel right. I'm like, this is not what I can do. And then the Lord literally was like, you need to do this. And so that was March of 21. I saw my first patients in July of 21. So 4 months.
Wow.
Like that is not humanly possible.
Right.
Yeah.
There was a lot of divine intervention there. I mean, it was like finding a location, developing protocols, setting up electronic health record. I mean, it's all the things, right?
Yeah.
That's wild.
So that was July. My husband's actually a PA. He was at Twin Cities Orthopedics for years and years and years. And
Ethan
then,
used to work with TCO.
Which doctor do you work with? We can cut this out too if you don't mind.
Dr. Johnson, Neil Johnson, over in Burnsville.
Yep.
Yeah.
I covered some Burnsville. I think actually your dad had his hip done by Dr. Johnson. I think his first one.
There we go.
Sounds about
When
right.
was that?
Yeah.
Tad may have been with them.
Probably was. It was probably 8 to 10 years ago.
Yeah.
He probably was. That's so weird.
Small world. Yeah.
So then he actually joined the practice, which is terrifying. Like
really?
both of us leaving our very, solid, good health insurance, good retire, like whatever, all in. And then we just moved to a bigger location in October, which was crazy too. like tripled our space, and we're basically growing out of our space at this point.
Wow.
That's so exciting.
But leading up to that, so my dad passed away at the beginning of October. We had a 3-day window where we're like, we're going to move our practice. We don't want to, because we schedule pretty far out. And so we didn't, like, we knew this move was coming. We were waiting for renovation. So we didn't know exactly when it was going to happen.
Yeah.
So we're like, all right, let's just pray everything's ready. We're going to close a little bit early on a Thursday and be ready to go on a Monday.
Wow.
So my dad passed away the week before, and then unexpected. So that was a whole, it was 2 weeks before. And then it worked. We got everything moved over that day. And then my husband, Tad, was in like a really, like, no one knows this, a really bad car accident that next morning on the way to the clinic to let in some like contractors who needed to finish. Like, he literally got hit in the back end and rolled his truck like 5 times.
Whoa.
Wow.
I don't know
Jeez.
how he's
The
even.
walking miracle.
Yeah. And so he's like, he calls me and I'm still at home, like getting the kids to school. And he's like, I just rolled my truck. Like, I need you to come get me. And I'm like what?
Yeah.
Like, I'm freaking out.
Yeah.
And I'm like, oh my gosh, like, we have thousands of people who are going to be like expecting us to be ready to go on Monday. And you just like, what is going on?
Yeah.
But he's like, you just need to come get me. And then I'm like, okay, what do we need to do? He's like, well, we need to like finish our day. Like, we got stuff
You're
to
like,
do.
you just rolled your
Yeah.
I
truck
was like,
5
oh my
times.
gosh. He was probably so sick of me. Like that whole day I was like, are you okay?
Yeah.
Like, just clinging. Like, oh my gosh, it was awful. But
Wow.
and now here we are.
That's so exciting. But that just shows, I feel like, that Minnesota needs you.
Yeah.
You know?
The
Feel
need.
like that's the kind of thing that it's like you didn't expect it, but it's like that's what
It's
was
crazy.
needed,
Like, that
you
is,
know?
yeah.
I feel like so many people are looking for answers on why they feel as bad as they feel and aren't getting a lot of answers or people listening to them. And so it's when you find somebody like that, you're like, that's exactly what
Yeah.
I
and just
needed.
like truth.
Yeah.
Like, that's the big thing for me is I don't even care if you are a patient of ours. Like, I just want you to know truth.
Right.
Right.
Yeah.
And that is a huge passion of mine because so many people, I think, get misled and taken advantage of, or they're just told they're fine
Yeah.
because they don't, and again, they just don't know.
Or they're like, you're healthy, you're fine. And you're like, I don't feel like that.
Right.
Yeah.
Which is hard when you're like, there is something off because I feel like people just know.
Yep.
And then to get dismissed.
And that's where so many times it goes back to this whole like thyroid thing
yeah.
where you're normal, but you're just normal.
Right.
You're not in the healthy range.
Right.
Right.
So that is exactly why you have all those symptoms because you're not actually optimal.
Right.
You're
Yes.
normal compared to the population, which is not healthy.
Exactly.
Correct. Not optimal, Ethan.
That's probably my biggest takeaway from this
Yeah.
whole, one of the biggest takeaways is
That is
it doesn't
huge.
necessarily mean,
Yeah.
I didn't even
never
know.
knew that.
yeah.
They didn't even teach us that. Like, literally, you can just Google this and Google
Yeah.
will tell you this.
Well, then
But
I would
they
imagine.
didn't even tell us this. I'm like, wait, I just trusted that every person I've told is normal.
When
that
it
they're
says
fine.
normal, you're like, yep, it's green light.
I would bet then if we went back and looked at, say,
Oh,
normal
100%.
cholesterol, normal range, like 10 to 20 years ago, it was probably a lot narrower. And now
Okay,
it's just
so
gotten-
here's the interesting thing about cholesterol. That's a whole nother topic. But cholesterol, the normal range on cholesterol is created by the American Heart Association. So in my opinion, it's actually it's too low of cholesterol. So LDL is actually a really good thing and it's protective for your body. And actually, as we age, people with lower LDLs tend to have shorter lifespan. So they have higher all-cause mortality with lower LDL. Okay, so that's a whole nother thing. But blood sugar, for example, I just had this the other day. It'll tell us when the range has changed. So it'll say like, no, reference interval has changed. And I don't know how many times I've seen like there's a new higher range of blood sugar.
Yeah.
Because
Just becoming.
so many people
more
have high
normal.
blood sugar.
Yeah.
Yeah. Wow. I remember when I got diagnosed and Ethan said her blood sugars are 416. And I was like, is that high or low?
Oh my gosh.
Like, because I hadn't,
Yeah.
I knew no one with type 1. I
Yeah.
didn't know anything. He's like, normal's 80 to 150. I'm like, Oh my gosh.
Yeah.
What?
That's so scary.
It's wild. But like, it's the more you know, because now I'm
Now you know all.
now
the
I
things.
know all the things. Like
Yeah.
somebody's like, my sister's daughter got diagnosed with type 1, and I was the one who was like, hey, can I check her blood
Your
sugar?
sister's daughter.
Mm-hmm. So my niece.
Wow.
And then 2 of your friends' kids in our like close friend circle, all within 2 months, 3 months of each other.
Last year.
Do you all live close?
Yeah, we do. My sister lives 5 minutes from me. My friend lives across town, and then our other friend lives close to over there.
That's weird.
And 2 of them, which is even weirder, they were both 10.
Mm-hmm.
And then the other one he was like 14, 15, something like that. So they were like the same age. And I remember when I saw her and we were like working out, and I'm like, she looks like, it's just, nobody had told me like, oh, Nevaeh looks like maybe we should check her blood sugar. Like that wasn't even a thing. I was like, she just is really being different,
Yeah.
But when you look at it now, even with our niece, I remember looking at her like, nope, I think she's in DKA, like for real. And then we walked in a week and a half later to my friend's house, who said, hey, can you check her blood? And we both walked in, and Ethan and I both were like,
gosh.
I think she's in DKA too.
Without even
And she
checking,
was.
we could
I
tell.
literally
Off
have
the charts. Yeah, off the charts. Like blood sugar's not even reading. Just actually, it said 600. I was like, holy crap.
Yeah.
So, but like,
Oh
it's
my
like once you see it, you just
know.
cannot unsee it. And now you can, it's like you have this X-ray vision that you didn't
Yeah.
have
Yep.
before,
Imagine walking around with that for like all the
Yeah,
Right?
no, I can only imagine. Your brain
like,
probably
oh,
is like,
you have parasites. You have a thyroid
Just
issue.
hand your card.
You need iron.
Yeah.
yes. Well,
It's a superpower.
it really is. It really is.
It
But
can be
some
a little
people are
overwhelming.
not. Yeah,
Yeah.
I'm sure some people aren't ready for
Oh, no.
that. You have to be ready.
I would say most
For that kind of
probably are
stuff.
not ready.
Yeah.
Yeah.
I rarely, unless there was one friend of mine that I'm like, I think you need to check his iron, like,
Mm-hmm.
but usually I just, unless someone asks me, I just kind of
Okay.
Yeah.
keep my mouth shut.
What about
Yeah.
me? She's like, I was told my iron was fine, but I don't know.
Okay, so
How
you
do you-
should look at your labs.
Yeah.
And we can absolutely connect. Like, I'm happy to
Yeah.
like give you some optimal levels, but your ferritin needs to be at least 70.
Okay. I just got that done too, so I could probably look at my email
Yeah, probably.
Mhm.
on my chart.
You can also look for a CBC and look at what your eosinophils or your EOS and your basophils, BASOS,
Okay.
are. Those can be some parasite markers.
Hmm.
So we want the EOS less than 3 and the basophils less than 1 or less.
Hmm. I need to
I
do
would,
that.
okay, just listening to you and everything you're telling me and your dogs and Grayson, like,
Mhm.
I wouldn't be surprised if there's parasites present.
Yeah.
Hearing, like, knowing kind of some of the, like, hormonal stuff that you're feeling, the period stuff.
Yeah.
That can be a So like I said, parasites and environmental toxins are going
Yeah.
to be your most common, like, period stuff.
Yeah.
Mm.
Like, even like a cyst for Nevaeh.
Yeah. Yeah.
So that one I wouldn't be surprised on. And then just there are probably some toxin stuff in there that.
Definitely. 100%.
And then we have to think about your poor filter.
I
Who knows?
know. I know. That's a good visual of like, maybe.
Yeah. That's
That's
way
probably what
more
the-
than anything I said. Like, that is.
Yeah.
There you go.
Well, all
That's
of a
why
sudden
I
our air
invite-
won't work.
That's-
Ethan's like,
That's why I picked her.
yeah.
I'm like, I need somebody to drive this candle thing home like once and for all.
Oh, I have a candle burning at home right now. It's my big ass candle
It's
too.
your big ass candle.
My big ass candle that's like this big with
Oh my
4
gosh.
wicks.
It just says super toxins on the side of it.
Well, we should wrap this up now, I suppose, huh?
Yeah.
I know.
suppose.
Otherwise, we could keep going.
I know.
Yeah.
Well, thank you for coming. Again, we learned so much, and I feel like this could be an ongoing thing because
Yeah.
I'm sure there's going to be a million questions too from others. Like, wait, I need more information
Like, let's
on.
deep dive on this specific topic.
Yeah.
I thank you so much for having me. This was fun. I was so nervous.
Were you? Yeah.
Meeting like a famous person.
Oh, no.
No, I'm so good. I think everybody comes in a little bit nervous. Like, I mean, it is kind of nerve wracking to be like, wait, what am I going to talk about? You have a lot to talk about though. You have so much information that I feel like we all need. So I appreciate it so much.
This is fun.
Yes.
You guys are just as awesome in person as
thanks.
online. So that's nice.
I always like to think of my online as people just there are some people that you watch and they don't feel like they're bringing you along life, and I just feel like if you're just everybody's coming with me along whatever I'm doing, it just seems more, like you're my friends and you're just seeing what we're doing,
It's amazing, but it's probably super weird because I'm literally like, I need to ask her about Austin and Nevaeh and all the things.
Well,
and you don't even know me.
Yes. Well, that we do. Now we do.
Yep.
I'm excited to learn more and do all the things. So it was awesome having you.
I loved it. Thank you.
Yeah.
Thank you, Jackie. Super, super inspiring.
Seriously.
Just kind of the whole, just hearing you speak and understanding and really being able to feel and hear your heart and why you do it. Mm-hmm. And like you said, you're not in here financially. You're in here to really help people and educate people, which is
I'm
cool.
all about that. Yeah.
Very cool.
Thank you for letting me.
Yes.
Absolutely.
All right,
Anytime.
you guys. See you in the next one.
Later.